do you know what a KTP laser is? Do you know what it is? Have you seen it before? Yes? Yes? Well, let's assume you haven't, because it's a very unknown treatment. Well, maybe I think here in Sweden it's quite unknown. In the Netherlands, everybody knows this treatment because it's a treatment a lot of people are doing every day. And we designed the ELVii actually as the everyday device. It's a device that is so broad in its use. You can do it you can use it for so many treatments that you will use it on one of your patients at least once a day. I'm going to tell you what you can do in a small story because I want to keep it. I want to keep it interesting, and the interesting part is actually showing you what it can do live. So I'm going to do a small presentation about how it works, the theory behind it, and then later we're going to show you the treatment itself because that's what it's all about. In a nutshell, the ELVii does this. It can remove veins very easily, and it's pain-free. So you see immediate result, and you remove the blood vessels. It's like using an eraser on a piece of paper where you draw on something. You can erase all the veins. That's very nice to do, actually. It's very a fulfilling job, and it doesn't hurt the patient, and they see immediate result, which is what everybody wants these days. They don't want to wait a long time for it. They just want to have the result right after treatment. Well, this is a treatment you can do it with. After that, you can also do it for a lot of other indications. So you can do pigmented lesions, you can do warts, you can do warts. People coming in, more people. Hello. Hello. So the ELVii is actually made, the name is ELVii, which is LaserVision. We make this laser. We've been selling it for more than 10 years already, almost 10 years. And there are hundreds of devices in the field. It's a super stable device, and it's a device, like I said before, you will use every day. So I will tell a little bit about technology, some of the things we can treat with it, how the treatment goes, and then later, of course, I'm going to show you in the treatment room here how to do the treatment, and you can see the result right away yourself. So it's actually a diode laser. A diode is a type of laser which can make different kinds of wavelengths. In this case, it makes 532 wavelength, and it's in the market, in the field, also known as KTP, which is stands short for potassium titanyl phosphate, which you can forget because you don't need it. You just need to know what it does. Nobody cares about this, but at least KTP is the thing you can remember, a KTP laser. It has a very high absorption in blood, like oxyhemoglobin, and in melanin. Those are the two chromophores. It takes the heat from the laser, or heats up those two chromophores. It's very superficial, and that's a good thing because it makes it very safe. You cannot do too deep of treatments with this device. I've actually never had long-term adverse results with a laser device like this, so it's very safe to use for anybody who walks in the clinic. There are limitations, which I will talk about later, but it's a safe-to-use device, and that's nowadays everybody want effect, but they also want safety, which this combines in one device, and it's very accurate. It uses a 1 millimeter spot size. You would think, oh, what can you do with a 1 millimeter spot size? Well, a lot, because lots of indications are not so big that we are treating. We're not treating full bodies here, so we don't need a big spot size. And a small spot size also means a very light handpiece. So this is actually the whole device here. It's 5 kilos, and the handpiece weighs about 100 grams. So you can use it all day for whatever you want without getting a tired hand. And everybody who uses lasers know that most lasers have quite hefty handpieces or arms that you use, and this one, well, it's a joy to use. We're using selective photothermolysis, so we're actively heating up the chromophores we are targeting. So in this case, the melanin, So if we remove pigment and the oxyhemoglobin. And we're doing it on such a small spot size that we're only using about 0.1 joule. It's very low. So that's why people don't feel it if you do the treatment. You just feel a little bit of heat and almost nothing. But you do see the immediate result. So that makes it safe and very effective, but only on that 1 millimeter spot. Everything around is safe. So you will never burn too much skin. You can practically never burn anybody with this device. It's a miracle if you do, and you get a little award, a bad award actually, if you do it. Well, the chromophores, I think we all know. There are 3 actually that we target with the laser. We're targeting 2. We do nothing with water with this device. It's in a totally different range, which is more for CO2. But we only target the first 2. And because it's a short wavelength on 532, it actually never goes deeper than about 1 millimeter. So we're never going deeper in the skin, so we cannot damage anything below. In these structures, we cannot damage. Does it make it effective on that depth? No. So can you treat blue veins on the legs, which are really deep? No, you cannot. Can you treat red veins all over your body or any other indication all over your body, which is superficial? Yes, you can. So you can use it for a full body, for superficial indications. Well, we have certain skin types, and because we're also targeting melanin, we have to be careful with the natural skin of the client who's coming in. So skin type 1 to 4 is safe. 1 to 3 is easy. 4 is for an advanced user. Skin type 5 and 6, you cannot treat, at least not vascular. Can you treat other things? Yes. If you want to treat skin tags on a skin type 5 or 6, you can. So if you want to have Morgan Freeman, remove him from all his I don't know how to call this in English, but if you want to make Morgan Freeman spot-free, you can. He will not let you, but you can. But because this is... Well, what happens with the pigment? Well, this pigment that you see in the skin, of course you need to know what it is. You cannot start treating everything that's a bit darker on the skin. You have to know what you're treating. It starts with safety. And so we're not treating moles, for instance. We're not treating anything that looks weird or is hurting or is looking like it doesn't supposed to be there. You only treat what you are 100% sure, which is safe to treat, which in most cases are lentiginous. So sun damage. Sun damage is the #1 thing everybody wants to have removed on their skin in terms of pigmentation. Is that safe to use? Yes. You can use it on all the body. You can use it everywhere, as long as you're sure that it's that indication you're treating. Actually, that is just a bit of pigment that's been made by your body because the sun shines. It gives you damage on the skin, and these pigment cells, they grow, and they just make a little lump, and that makes up the lentiginous. So can you remove it? Yes. By heating it up, it will fall off like a little crust. Often it's a 1 or 2 treatments, and then, well, it's gone. And you can repeat this process as many times as you want. Not for the same spots, but you can repeat this treatment every month if they get new spots. So it's not something that you can only do once or twice. You can keep on repeating it. We can only treat the dark pigment. Yes, of course.
Because I thought about these treatments, is it better to ask the client to come in the autumn and the winter?
Always.
Yes.
Yeah, if you are super safe in autumn, winter, and spring, like those 3 times of the year is amazing, because there's 0, 10, well, probably as much as we have in Amsterdam, so very little. So it's very safe. In summer, you always have to be a bit more careful. I will come to that a bit later, but it's a year-round device, but you have to make sure you're not treating too tanned people. That's the only thing you have to be careful, because if you do vascular and somebody is too tanned, they're in competition. So you want to treat vascular, but you also see some tan. So they both absorb some heat, which can lead to the vascular may be gone, but you also have some pigment which is gone. But it's very superficial. It will only look weird for a couple weeks, but still it's not ideal. So can you do it? Yes, you can. Do you want to do it? Maybe not. So it's not bad in long term. So you cannot damage the melanocytes, which are deeper. You will never target it with this device.
Okay.
So if you look at IPL, which goes a lot deeper, you can do actual damage to the deeper layers, which is absolutely not okay doing in summer, which if somebody's tanned with IPL is very dangerous. So with this device, partially you can, yes. But the other 3 times of the year, except for summer, is brilliant. You can just treat all year round with that. So hyperpigmentation, well, it looks something like this. You have it in many forms and many whatever people are growing everywhere. You have to make sure what it is. If you don't know what it is, you send them to a doctor. If the doctor says it's benign, you can remove it. They can come back and you can remove it. Actually, with pigmented lesions, the pigment always after treatment first gets darker, and then it gets a little bit of a crust, and then it falls off. With vascular lesions, the body actually absorbs the veins, and they remove it from the inside. So it's a different process. But eventually, it will be removed, which is the end point. And often it's only 1 or 2 treatments. So how does it look? Well, this is the ideal. If something like this comes in, I'm always getting happy because this is like a 1 to 2 time treatment, which a lot of people have. It's super easy to treat, it doesn't hurt, it goes really fast, and almost everybody from a certain age will get this because it's just sun damage on the hands. Some people also have it on the sides of their face, here around here. Super nice treatment. It's the best indication, I would say, for this device. The easiest to treat. You will never go wrong with this. The bigger it gets, the bigger the pigmented lesion gets, the harder it becomes, because you're only using 1 millimeter. So can you treat this big pigmented lesion? You can, but I would not. I would say if you can make a round with your finger, that is the biggest size you should treat with this device. So anything bigger than this, you should not treat because it's very hard to completely treat it. So what's the option then? There's only IPL or a Pico Plus, if you have it. But not everybody has a Pico Plus, which is 5 times more expensive. But if you have it, that's a better option. For all the smaller things, the ELVii is a very good option. Also for backs, and you would think, oh wow, this is too much. This is a lot of work, but also people will be very happy if you help them with this. And yes, it will take a long time, but can you do it? Yes, you can. So there are a few different indications. So lentiginous is the first. Seborrheic warts, which are like darkened warts, you can treat, and anything in between. Other things like melasma, Becker navy, which are like bigger and often have hairs in it, those are not great indications. No. But we're focusing more on the indications that most people have. So these, probably a lot of these, well, melasma is more and more, of course, but a lot of these other things you will probably almost never see in practice. But lentiginous, almost everybody has. Even we, I was pointing to you because they're quite young. Even they had some on their hands, and they are only 20-something years old. So the older you get, the more you get. Okay, what about vascular? Well, vascular is just as nice as pigment, but even nicer because you see a direct result. Yeah, we use the same principle. What's the function of this blood vessel? Some people often ask, can you remove them? If you see the blood vessels on your face, on your body, is it safe to remove them? Yes, you can remove everything you can see from the outside on your body because you absolutely don't need it. It's all not, doesn't have any function. It's often a hair vessel which is dilated to a bigger size because it's been irritated, and it shows more. And some people have it more than others. If you have it, you will have it for the rest of your life. It will start coming back. If you remove it, it will always come back. That's a good thing because we want people to come in every half an hour, every half a year to do maintenance. So if you remove the blood vessels, those are gone, and they will come back in a later stage. But the ones you have removed, they will be gone. So yes, it's safe to remove any blood vessel you see on the body. You will not need to question yourself, is maybe this needed for any, does this have any function? The answer is no. Any red vessel on you can remove. There's no...
Does the cherry spots come under these?
Yes.
Yeah?
Yeah, you can remove them all day long. They have no function. They only bleed if you scratch them. Yeah. So.
Because it's like blood vessels then.
Yeah, it's free. You can remove them every day. It's very nice actually, and it works really well.
Yeah.
It's just a one treatment. Yeah. Well, how do these blood vessels come to be? Well, they're just irritated, or they get a lot of exposure, a lot of damage. You drink alcohol, you smoke. You can get it from so many things, and that's why so many people have it. It starts always around the nose, actually. These are the first places, then they come here, then they come there, and before you know it, your face is covered. Can you treat them all? Yes, you can treat them all. So you can treat the whole face and the whole body. Is there anything you can do about it? Well, if people have a certain lifestyle, they will probably not change it if they get this. They will just get this treated, start drinking and smoking again, so they can come back later and do the treatment again, which is good. Yeah, this is good. Because it's a nice treatment to do. It is a very addictive treatment, because if you do the treatment, you actually see the vessels disappear right away, and it gives a very, well, it's like a little game. You keep playing, you keep on removing all the little veins, and later after treatment, you give people a mirror, and they see themselves that actually everything is gone. Like, wow, it's before and after in 1 hour. If you do a complete treatment for a complete face. How does it look? Well, it looks any part of red on the skin. It can be in little veins, it can be the cherries, it can be little like telangiectasia. It could be bigger spots, even on children. You could do this, but only with a doctor's supervision, of course. Actually doing this on children, on port wine stains, is very effective, because it actually makes them less pronounced when they are getting older. The older you get with a port wine stain, the harder and the bigger the veins will become, and they will be very hard to remove. You will actually need to use different kinds of lasers for removing it later on. So it's actually being done on children on a very, very low age to make sure it doesn't get too big when they are growing. Well, and then we have the rest. And the rest is actually a coagulation. So the device, besides vascular and pigmented lesions, can also be a coagulator. So you can remove actually anything that's growing on your body, which is benign. When you know what it is and you don't need it, you can remove it. So this is warts, this is skin tags, this is xanthelasma, this is actually anything you want to have removed. Lumps, bumps, as we call it. So things actually with probably no other device on the market, you can remove this very safely. And that's because if you use, maybe you know CO2 laser. With CO2 laser, if you would remove these, you will get a lot of wounds, which is not nice. And the healing will hopefully be okay, but there's always chance of a hypo or hyperpigmentation. With ELVii, you can treat this, but you only coagulate these parts on very superficial level. So you only make sure they're heated to a certain point, that they are being absorbed by the body more easy, and there's less chance of hypo and hyperpigmentation, because it's also closed. It doesn't open up the skin. So it's super safe for treating actually these types of indications, or for skin tags. For skin tags, it's the same. Normally, they would chop them off with a knife, or they use a curette, which is the right word, or CO2 laser, but it smells quite bad. It leaves blood, and it can induce scarring. And with the ELVii, it does not, which is too good. It sounds too good to be true, I know, but it's true. It's actually one of my favorite treatments beside the vascular, because a lot of people have these kinds of things and they have no idea how to treat them. They have nothing, there's nothing comparable to it. There's no other laser device except for CO2 and erbium which you can treat this with, but it's very painful and it can give a lot of scarring, and it's not the nicest treatment to do. With ELVii it is, and it doesn't hurt. Well, xanthelasma, something you may see in the field. I actually have one colleague who has this around the eyes completely, and we treat him once a year, and it's day and night. It's a totally different person, because nobody knows what it is. It's just like a fatty tissue, actually, is sort of. You treat it with the coagulation mode, and goes away in 1 to 2 treatments, and then it will come back because it's genetically, so it will be good for revenue. It's often caused by high levels of cholesterol, which I can confirm with my colleague who likes to eat a lot of fat food. So yes, but he's not fixing his lifestyle. He just does one of these treatments and then goes back on eating like everybody else. This is also amazing to do. Skin tags is super quick treatment, and these one actually they give like a pop effect on the skin. You hear them sort of explode. Then you leave them, and in a couple of days they will fall off the skin and they're gone. So you don't take them away completely. So it's super safe because they are closed. There's no risk of infection or anything, and very little risk of scarring. Very, very good treatment. So that's what I mean. You can do so many things with this device, that all the things I've just shown you, like the vascular, the pigment, all the indications, the warts, the skin, everybody who gets in the clinic will have one of these things, I'm sure, somewhere on the body. That's why we call it a device you will use every day. So everybody who comes in has something. And that's the part of the device. It has a very fast return of investment, because every day it will generate a couple €100 for you, which, well, it's compared to the price it costs, it's a good ROI. Well, settings and protocol. We're using the KTP wavelength, which is very visible light, so it's a greenish light. It's a green laser. We can set the pulse duration short or long, depending on the thickness of the veins. Often we use a medium as our protocol, which is about 20 milliseconds, which works for 95% of all the indications we just talked about. Sometimes we have to increase it just a little bit to, let's say, 30 for the thicker veins, but in most cases we only increase the power, and the power is what gives us our clinical endpoints. So we see a vein, or you see a bit of pigment, you shoot on it. The vein you will want to see disappear completely, then you know you hit the right power. If you don't see it go away, you increase the power by 0.2 watts, and you try again. That's the only thing actually you need to change. If you want to be lazy, you can put this just on 3 watts and treat everybody with 3 watts, and you'll never need to care about settings again, which is like the lazy way of using the ELVii. Of course, has all the settings inside the system. It will help you guide through it. You just have to press what you're going to do, which skin type, and it will give you automatically the right settings. So you don't really have to think about it if you don't want to. It has more energy than you would ever need. So often we use only 2.5 to 3 watts, and it goes to 4, which is too high, because then it really starts to make damage on the skin. But it can, because people always want to have their device being able to burn somebody. It's like a car. We never drive faster than maybe 130, 140, but everybody wants their car to go 200, at least for all the men who are watching. Probably none. So. Okay, the treatment, of course, you have all the consultation, the questions, same with every other laser device. So tanning is the most important thing you should ask about, but also all the other things like pregnancy and all the questions you are known to if you're into laser treatments. It's not different like from an IPL treatment or hair removal or fractional, any of these. There are forms, you can just reuse them. It's all pre-made by us. and it will help you give a sense of the patient's if they're healthy or not. So if they're healthy, you can just treat them. If they have all kinds of medications or all these things, you can always do a pre-check before you do the treatment, of course. Making pictures is nice because before and after picture for vascular you can make on the same day because you treat them and there's before and after. So a lot of these pictures from this book are made from before treatment, after treatment. For pigment, of course, you make pictures, takes a bit longer, and for skin types and warts. But always make pictures. The contraindications, we go very quickly. The suntan skin is number one. It's always number one because we're treating pigment. Medication, if people have medication which gives them a heightened sensitivity to light, is often antibiotics, for instance, or some other medications. People know this if they take these kinds of medication because they say I have to be careful with light or any other. Then for you to say, okay, what am I using to treat? Oh yes, it's a laser, so it has to be light. So I have to be careful as well. Bruising, only if you do very large areas of vascular, you can get a more bluish color afterwards, but it's very rare. Very rare. So the contraindications are quite small. Then you have the contraindications which you just have to keep in mind. Pregnancy, well, what we say, if people are pregnant, just don't treat it because if something happens, it's always the laser because people don't understand the technology. It's only light, but still, it's always the laser if something goes wrong, so just don't do it. If something is inflamed or infected, you're not treating infected skin, it's not the way to go. If somebody has active herpes, maybe not the best. Epilepsy is a bit strange because epilepsy, yes, you can treat, but if you're treating around the eyes, light can seep through the skin, through the eye, at least through the nerve, so you can see flashes, and you have to be aware that some people can, because of the flashes, they can get epilepsy. I've never seen it, but could happen. And some other things you should not treat, which are vitiligo, for instance. If people have a pigmented disorder, you're not going to treat them with a pigment laser. It's often not the right idea. Before you know it, you're Michael Jackson. Then you have keloid. If you make too much damage and people don't heal up nice, it looks weird afterwards, and you have a bad device. So those are all things you should consider with all your treatments. What am I doing? Am I making a lot of damage? Then people who have a lot of hypertrophic or keloid scars is not your patient. You send them away. Well, some indications, just to make people scared for the treatment. There is a small settings guide we have. It's also in the system, so you actually don't need it. Small procedure, just clean the skin. You don't need to put any gel on it. You have no disposables on the device. You can just use it as it is. And yeah, afterwards you can cool the patients. Often it's not needed because you don't use a lot of power, a lot of heat. And so you don't need to cool people a lot after the treatment. If you do IPL, people can get really hot and a lot of swelling. And with this device, it's almost nothing because we're using just a little bit of energy. So how does it look? Looks something like this. Again, so between the two legs, the pulse is going. You see the vein disappearing between it. And you actually follow all the veins. You can put the speed as fast as you want or as slow as you want. You can put 20 pulses per second or 3, which is the standard. And you can just follow all the veins you see. It goes a lot quicker than you think. So treating actually like 2 cheeks is about 10 minutes if you are if you're not skipping spots. So if you're doing a good treatment, it's about 10 minutes. If you do a full face, somebody has a nose, all the usual suspects, it's about 20-25 minutes. And you have a full face, so in total you have half an hour of treatment of cleaning and saying goodbye to somebody and swiping the card. So, clinical endpoints, I talked about this before. So what do we want to see? And how do we do it? Well, first you see the veins. If somebody with this comes in, I'm already happy, because this is, for us, this is amazing to see, like, wow, I want this because I can make it like this. This is directly after the treatment. You see it's a bit red. The red will go away in a couple days, and then it's gone. It's a one-time treatment. There below is a superficial wart. When treated, it looks a bit like chicken. It's a bit whitish because it's coagulated skin. And later on, it will fall off like a crust, and it will be more flat. And you can repeat this until it's as flat as you want it to be. And if you don't get the result, so we use the device on, let's say, this vein, and we don't see the result, the only thing we have to do on the device is increase the power by 1.1 or 0.2 watts, and we do again until we see the result we saw with the video. You want to see the vein disappear completely. With pigmented lesion, you actually want to see it darken, and you hear it when you do the treatment. You hear a bit of a crackling now sound. The crackling sound means the pigment is falling apart, which means you are at the good energy level. If you don't hear the cracking sound, you have to increase the power. It's very noticeable. And often with pigmented lesion, you also see a little bit of smoke, because the pigment is laying on the skin. It can go up a little bit in flames, or smoke in this case, not in flames, in smoke. With skin tags, well, you want to see the whitish color. That's the indication, like chicken. You want to bake it like chicken. It sounds weird, but it's true. Sometimes when the lesion has a bit of pigmented in it, so if we have a lesion like this and has a bit of brown spots, the brown spots can become darker, so they become a little bit blackish. That's a bit carbonization. That's okay. That will go away. It's the same with the lesion. It will just fall off in 1 to 2 weeks. So what can we do with it? Well, a lot. So these things you can remove. This is one treatment, and this is a 10-15 second treatment. So if people come in with this, you put on the device, and all good? Drinken? Bluish veins, can you treat it? Yes, you can, as long as they're very superficial. And you know when they're superficial, when they're very sharp. So this time, you see this very sharp image. So then they're superficial, you can treat it. Doesn't matter if they're red or blue or yellow or green. As long as they're superficial, you can treat it. And they're deeper, they're more washed out. They're like a little bit of blurry. It's often on the legs. You cannot reach it with the ELVii. So you need a different type of laser, and the ag. So you cannot treat that. But anything that is superficial, you can treat. Around the nose, well, it's a big telangiectasia. You can remove it, it's one treatment. Any other superficial red spiders, just veins in the nose, on the nose, under the nose. Pigmented lesions on the nose. It's one treatment to give you an indication. Now, we always say 1 to 3 treatments because we want to have a little bit of flexibility. If you say 1 and it's not done in 1, then you're bad. So we always say 1 to 3. So we have 2 more to make up for the errors you did the first time. Often with one treatment you have about 90% of effect, and the second and third treatment is to put the final touch, like a touch-up treatment. So let's get ELVii.